Hello and welcome to the De-Stress Podcast with me, Dr. Amanda. On this podcast, we sit down and we unpack the often underestimated impact that stress can have on our lives and our bodies. And I do this through sitting down and having fascinating conversations with experts and everyday people. And today is no different. I'm really excited about our guest today. It is going to be, drum roll please, I'm sitting down with Lauren Johnson Reynolds, who's also known as the London Wellness Coach. Now, Lauren, she's going to be telling us her journey into the world of polycystic ovarian syndrome and becoming a health coach. Now, Lauren's background, as you will hear, wasn't necessarily in health, but as she started to navigate her own journey and her own diagnosis of PCOS, she actually took a real deep dive into the whole condition. She learned how to treat herself, became pregnant, which she's going to share with us how that all went down, and then decided to start helping other people. And so that is the conversation today, something that I know a lot of you will really benefit from. Some of you may be struggling with infertility, struggling with getting on top of your health, understanding how to be a health advocate for yourself and where to find different practitioners, different health professionals who may not be doctors, but can also help you in your journey to wellness. So I really hope you enjoy. Please, if you enjoy these conversations, if you've enjoyed these conversations so far, don't forget to hit the subscribe button, whether you are watching on YouTube or listening on Spotify or Apple. And also please leave a comment, please please share with people that you think is going to appreciate the conversation. It all helps the message to grow. And something that also really helps is to rate and review the podcast if you are on podcast streaming sites. And so a 5-star review is really appreciated, but anything honest about the conversations and what you found from them would be great as well. So enjoy the episode. So hi Lauren, thank you so much for joining me today on the podcast. How are you doing today?
I'm really well, a little bit chilly today actually. The weather's
It's really
changed.
cold. Yes.
Yeah.
And you're down in London, aren't you?
I am, yeah, North London.
Yeah. And they say it's always supposed to be
Mm.
hotter there, but I'm glad to hear that you're also a bit
It's
chilly
freezing.
because it's freezing today.
Yeah.
Um, and I'm really excited to have you onto this podcast. It's been a conversation that I've been waiting to have, and I know lots of the listeners, the viewers, we really will take a lot from what you've got to share. I always like to intro things a bit about how we kind of connected, or why I would love to have you on the podcast. And I remember you popped into, I think it was my DMs or somewhere, that you were doing a course all about polycystic ovarian syndrome and wanted some, an input from a medical doctor about navigating that because you were doing a course. And I was like, this is so interesting. And then I went onto your page and I saw all of the work that you were doing in this realm of this condition that's so difficult for so many people, in terms of knowing what it's all about, how to get diagnosed, how to get managed. And one of the things that I found the most interesting was that although you are an expert in PCOS, you're not from a healthcare background. You're not a doctor, you're not a nurse, you're not a nutritionist. I believe your background is singing. And just the question is, how did you get into this space? How did you find yourself here? We'd love to know more about you, more about who Lauren is, and how you found yourself as this health coach and PCOS expert.
Yeah, so it's been a long road. I've always loved singing. It's always been what I've wanted to do. I had a few months where I thought I might end up being a midwife, but even then I'd applied, I'd put in my UCAS, don't even know if that exists anymore, but I'd applied, I'd done all of that, and then I just thought, no, I want to sing, and I just changed everything. And I went to uni and I did a music performance degree. Okay. So I was like deep into the world of touring and working with bands, and I was loving it. Mm-hmm. But my PCOS was at like an all-time low. I was feeling so bad. I had really debilitating anxiety that I was struggling with. Mm-hmm. And that was actually taking away a lot of the enjoyment of my job, because I had such, anxiety and paranoia. I would be on stage thinking that the people that were in the audience were, thinking something about myself, how I looked. I had really severe body image issues and disordered eating, acne. I wasn't ovulating. It was just horrible. I was really struggling. And I'd been on and off the pill for years. I was diagnosed at 14. I was on the pill by the time I was 17. And anytime I tried to come off it, my acne would come back with so badly that I would always end up going back on, even though I
Okay.
knew it wasn't what I really wanted. I
Mm-hmm.
didn't feel I had a choice. So when I was about 26, I thought, right, I'm going to come off the pill. And I actually sought the help of a homeopath and herbalist
Okay.
who really helped to support my body while coming off the pill. And for the first time ever, I was actually able to come off it and stay off it because he really helped to just, my body was able to balance.
Mm-hmm.
And for the first time in my life, I was having a regular cycle, and it was just incredible. And because of the anxiety, I wasn't enjoying my job as much. And I thought, you know what? I'm going to do something else. I was really inspired by him. I
Okay.
ended up enrolling on a course that was integrating nutritional therapy, homeopathy, and life coaching. And that's how I ended up in this space. So
Mm-hmm.
as soon as I started learning, I couldn't believe the nutritional points that we were being taught. They were just life changing from the get go. And as soon as I learned about blood sugar balance, I instantly saw a reduction in my symptoms, and I was so impressed. Qualified in 2020 as a nutritional therapist, and the rest is history, I guess. I still do sing. I still love
Mm-hmm.
singing. I'm literally off to a singing job after this.
Oh,
But
amazing.
I have so much passion for women's health
Mm-hmm.
that it's become such a huge focus in my life now.
Yeah. That's incredible, honestly. And I always say there are healthcare professionals that may be the experts, and for the listeners, that's in like inverted commas, that there's experts, but really until you experience something yourself and understand the impact of the disease, it's often very difficult to treat it properly, holistically. And me coming from like the more a very traditional medical background, it's actually wonderful to see so many new different kind of practitioners coming up that are able to support people in the health, because health isn't just one dimensional, and it's not just enough just have that paternalistic doctor who just tells you what's happening, what you got to do, you follow it or you don't follow it, and we just move on. There has to be a lot of taking ownership, and some of them might be finding somebody who's an expert like you to support them, or like you found your herbalist, and it may be educating yourself. Not everyone will go into a deep dive like you did, but really trying to figure out your health for yourself and taking your health into your hands again. And that's one of the big things I
Absolutely.
really wanted to talk about in this episode. On this podcast, like I say, every episode, we talk about stress. We talk about in life, we can't avoid stress. If we're living life, we can't avoid it. But it's about how we manage it and make sure it doesn't become toxic in our lives. And there's lots of different stressful elements that happen. But one of them is dealing with health issues. One of the main reasons why I became a doctor in the first place, and why I still am a doctor, is that I know that when somebody's health is compromised, no matter how much money or how much friends, whatever you've got around, it's such a vulnerable place to be, and it can be the most difficult thing when your health isn't quite right. Even if you're doing something you love, you were singing just as you love to, but because your health wasn't where you needed it to be, it was making the things that you love less enjoyable. And
Absolutely.
so but the problem is, here in England, the NHS, it's a wonderful system for many things, but a lot of the way in which medicine is done traditionally helps about 10% of things. But really, the other 90% is all about lifestyle and education, and about people taking their health into their own hands. And it isn't just a prescription that can be given or a surgery that can be given. Like I said, only 10% of health issues actually benefit from those things. And so the stress that comes from taking your health into your own hands when you don't feel like you have the qualifications is what I would love to talk to you about today, because you reduced sounds like a lot of stress that was happening for you by taking the ownership of it. And so just kind of exploring that journey and what kind of tips you have for the listeners who may be on the same kind of path is what I'd love to talk about today.
Yeah, absolutely. So yeah, like you say, having a chronic health issue brings with it so much stress. And for me, part of this chronic health issue is, what I was told at 14 was that I would probably not be able to have children. So that level of stress and strain, I call it, the dark cloud that was over my life, because it genuinely was. Anything that I was doing, I had this horrible fear that I was infertile hanging over me. So not only did I have the stress of dealing with the day-to-day of a chronic health issue, I then had this infertility fear. And it really did impact my life, you know, like I said about the anxiety. But then also when I started to take matters into my own hands, as much as it was incredibly empowering to know actually for the first time in my life, there was a lot I could do for my PCOS that wasn't taking the pill or being put on fertility drugs at some point.
Mm-hmm.
It was also very overwhelming because I went
Yeah.
from not knowing what I could do to
Mm-hmm.
knowing too much
Mm-hmm.
about what I could do, and almost felt like, well, what's right? You know, what this person's telling me this person's telling me that. There's so much information. So yes, it is incredibly empowering to
Mm-hmm.
know that you can help your own health by changing sometimes the simplest of things in your diet and lifestyle. But
Mm-hmm.
also I think it is useful to see a professional, a practitioner
Oh yeah. Mm-hmm.
who specializes in what it is that you're dealing with,
Mm-hmm.
because they take the stress for you in a way. They
Mm-hmm.
take that strain, so you're not sitting there looking at all this information thinking, well, what applies to me?
Mm-hmm.
They can do that for you, and they can really
Yeah.
hold your hand. And when you have that accountability and that support, you will just get better results, because you've got somebody, it's like somebody's hugging you all the way through this journey, and it makes a huge difference.
Yeah.
But having that empowerment and knowing that I could help myself reduced my stress massively.
Mm-hmm. And that's the thing, having your own part of taking your health into your own hands isn't about doing it by yourself. It's about knowing when you need help and where to find
Yep.
that help as well.
Yep.
And so I say all the time, taking things into your own hands, maybe just booking that appointment or asking the right questions or searching on Google the person that specializes in my area, or
Yeah.
just like finding out the name of this medication that's being said to me, or finding out what
Yes.
this sort of diet is. Taking it into your own hands doesn't mean doing it by yourself. It just
No.
means being intentional about it and not just letting it go from a symptom that never gets looked into, or an appointment that you go to and you get told something disappointing, or you get told something unexpected, and then just leaving it there and deciding, that's the end of it. I really wanted to go back to that time though, when you were first diagnosed. How long had you been having issues? How did this, can you tell a bit of the story, like how you actually came to find out you had PCOS and this horrible thing that I can't even, I hear these stories all the time. You hear them online from patients,
Yeah.
conversations that they've had with doctors, healthcare professionals. And what you just said, that you at 14, 15 were told that
14.
you're infertile because of PCOS. And it's just like, what?
I know.
Why was that a conversation to have with a 14, 15-year-old?
Oh,
What? It's not even true. It's not
I know.
true.
It's not even true.
It's
And
not even true.
no, I know. I really feel it was irresponsible of that
Mm-hmm.
doctor to say anything like that to me at that age.
Yeah.
And I was offered there was no aftercare. There was no like, is she okay? It was
Mm-hmm.
just, so I'll go back to the beginning.
Yeah.
So I started my period at 13,
Mm-hmm.
which is probably quite normal. I think probably people tend to start their periods much earlier these days. But it was late for my family. My family
Mm-hmm.
like kind of always started their periods 9, 10, 11,
Mm-hmm.
which maybe is a little bit early, I don't know. So me starting at 13, I actually think that was probably the first indicator of my PCOS. And then I didn't really have a period again. So they would come really sporadically, which I know can be normal in your teenage years. But I wasn't having a cycle for, 8 months at a time.
Mm-hmm.
So we did try to investigate. We tried to see what was going on. Eventually, we ended up going private. And that was when I was giving my borderline PCOS diagnosis. So I still don't really know what borderline meant. I think with what I know now, I assume that it was because I couldn't have an internal ultrasound. Maybe she wasn't able to see as clearly if I had the follicles on my ovaries, or maybe I was kind of like borderline for having the amount that maybe fitted the criteria for a
Mm-hmm.
diagnosis. But I was told I had borderline PCOS, and it was the reason that I gained weight easily, and it would probably mean that I would not be able to have children naturally. So at that age,
Is there a time you
14
say it?
years
I'm
old,
like, oh my gosh.
I know it's like a punch in the gut, because
It's like,
it was just,
why?
it's really
Yeah.
shocking. And I don't even think maybe I realized at the time what a big deal it was, but I remember leaving with my mum, and I think I remember her crying in the car, and she was really, really upset at the diagnosis. And then I think that really hit home to me, like, wow, this is a big deal.
Mm-hmm.
And I found an old diary of mine, a couple of years ago, and in that diary, I'm literally writing. I'm probably about 15 at this point. Oh, because of my PCOS, I might not be able to have children. I really hope I can. And it came up again and again in my diaries. I
Mm-hmm.
started my period today. Hopefully my PCOS is getting better. Like, it was a real feature from that young age in my life, and I really carried that through. Um, and I think even now, obviously, I know it's not true because I have a little girl, and it did take some work, did take some doing, but
Yeah.
I was able to get pregnant with her naturally, purely through changing my diet and lifestyle
Mm-hmm.
and learning my body's signs of ovulation, so that I was able to help that pregnancy happen.
Mm-hmm.
So I know that isn't true, but you know, I've talked about this before, but I really feel like being told something like that at such a young age, that has become a part of my core beliefs. That is like a part of my belief system now. So even
Mm-hmm.
through having her, there's still a part of me that wonders if that was just a fluke. Can I get pregnant again? It's all of
Mm-hmm.
these things that I don't think people realize, the stress and the strain that it puts on the body, being told something like that at such a young age.
Yeah, that's the thing. We often speak about the mental load of things. Often you hear it talking about motherhood. So like the mental load that comes with motherhood, all the things that
Yeah.
are there in the background. But actually there's a lot of mental loads that come from so many interactions that we have. The problem is, not the problem, but our brains, they want to make things true. So whatever, they want to make sense of the world. And although it's this
Mm.
amazing, the brain is amazing, there are some things that will have a big impact that it will cling on to and say that, well, this is
Yes.
the truth. And
Hmm.
it takes so much work to undo some things. And there's other instances, it might be something big that you're told, like, oh yeah, you're going to struggle to have children. Saying that at such a young age, a formative age,
Mm.
where your brain is still developing, and having that put in there as one of your core beliefs, then to work past that, even after having a child, still having that there. And then the other thing as well is, like, if you're told things perpetually, if you're told things again and
Yep.
again, that, for example, PCOS, when I first learned about PCOS in med school, I didn't ask that many questions about it, but what we were told was that it can be one of the reasons why your patients are gaining weight or are struggling to lose weight,
Mm.
but the treatment for it tell them to lose weight. I was like, okay, the
Okay.
calculation here, because the PCOS, they are gaining weight or struggling to lose weight, but they have to lose weight, and that's what you need to
Yeah.
tell them, lose weight. And it's
Yeah.
like, is that it? Is like, what else are we saying? And
Oh.
sometimes we're given these headlines to say it as, we're not told enough information.
Mm.
And we just give these snippets to patients, not realizing the impact that they're having on their,
Yes.
like, their mind, their mental load, then carrying that with them. Like,
Absolutely. Yeah.
just
I know. I had a client, bless her, she
mhm,
was a young girl. She was really young. She's at uni. It was
mhm,
recently this year. And she was told by her doctor to lose weight, and she went away and she reduced her calories and she lost a bit of weight, and then she went back again, and the doctor said, great, keep doing what you're doing. And then she did it again, and she was reducing and reducing and reducing it, to the point that she was like, you know what, I can't reduce them anymore. Went
mhm,
back to her doctor, and the doctor was just kind of saying, well, just keep doing what you're doing. She was like, look, I'm not, and I feel like I'm getting a bit of disordered eating.
mhm,
And the doctor couldn't really say anything to her. They were just like, okay, well, just keep reducing. And it was just like, where does this end?
mhm,
We already have such, I think the stat is that we are 4 times as likely to experience disordered eating, binge eating disorder. And I know where this comes from. Body
mhm,
dysmorphia is rife within PCOS as well. It's because our symptoms are blamed on our weight. And like you say, it's a really flippant comment. And then this patient goes off, and a lot of people really look at doctors as, um, you know, like they're saviors.
mhm,
The doctor is the person who is going to get them through. And when they're told something like that by somebody that they really believe and respect, it can have a real bearing. I just used to
mhm.
dread going to the doctor and being weighed, because I knew that it was like, okay, well, this is because of your weight, and it's just really damaging.
Yeah, there's the whole conversation of weight and in medicine and how it's kind of perceived and how it's spoken about. There's been a lot of issues there. The thing is, we're
Mm.
taught so much that there's all of these poor health outcomes that come from being overweight, and then we're
Mm.
told that weight, if you have less calories and you move more, you will lose weight. And it's
Yeah.
kind of simplified to that. And that is really like the things that we're taught, that it's
Yeah.
simplified down to that, even though there are so many healthcare professionals that have this knowledge, have the same amount of
Mm.
willpower, or, whatever, supposed to be quite disciplined, organized people that also
Yeah.
struggle with their own weight as well. I remember when I was training, doing my GP training, one of my supervisors at the time, he was like, yeah, what I do is I just make sure there's always a scale there and I just get everyone to stand on it. I just get everyone to stand on the scale. I was like,
But
why?
why?
And he goes, yeah, if someone comes into me and they're talking about their knee pain on the scale, there's your explanation. And I was like, it's just so, and that is, that's the battle. And the thing is,
Oh.
when you asked me to do this video for the course, for
Mm.
this course that you've done, I wanted to talk about why there is such discrepancies
Yeah.
throughout the kind of doctors that you'll get, but also to highlight why it's so important that we lean on other people that are in different arenas.
Mm. Mm.
As a doctor, we learn so much, right? There's, especially if you're a GP, for example, which is often
Yeah.
people's first port of call, we're learning everything from pregnancy all the way to elderly. We're learning about cancer and muscle
Mm.
problems and hormone issues and
Yeah.
hearts and kidneys. And there's so much
Yeah.
volume of information. There's known how to do all the cute things. And so there are great things that we're really good at. But what is often missed is that we're not good at everything and we're not trained for everything. And so
Mm.
it's always a question to me, why are we left to be the ones? And it's the system that's there. Like this is the people you're told to go to be the ones to talk to you about your weight management. Why are we left to be the
Mm.
ones to talk to you
Yeah.
about, how to improve your diet or how to
I
move
know.
differently or understanding, like when we're not given the tools to do it. And
Yes, absolutely.
it does a disservice to people as a patient, but it also does a disservice to doctors as well. Like,
It
we have
does.
such great skill set, but then a lot of the time our consultations are rubbish, or we're not helping people because we're being asked to do things that we're not trained to do. And there's not many other
Absolutely.
professions that happens to.
No.
So, like, in our practice, we have a mental health nurse, a physio, a pharmacist, and we
It's
have
great.
like practice nurses too.
Mm.
They see things, and if there's anything that's out of their scope, they say that I'm not trained to do this, then they send back to the GP. You go to like consultants, they send it back to the GP. And so that's why
Mm.
I'm just so glad to have another practitioner on to really share what you do for your clients, for the people that you
Mm.
see, so that people can see that it's okay not to just see your doctor. It's okay if the
Yeah.
information, or if it's not equipped. And I know there's healthcare
Mm.
professionals that are listening to this episode too. It's okay if you're not equipped, but find out who is there so you can actually signpost your patients to the right places. And so as your
Absolutely.
role as, this as a health coach and nutritional coach, is that right? Have
Mm-hmm.
I
Nutritional therapist. Yeah.
nutritional therapist, sorry. What kind of things have you been able to do for your clients? How have you seen that working in tandem with, what they're doing with their own like traditional doctors as well?
So one thing I do say is that yes, you can go and do alternative things. You can see a practitioner, but don't discount going to your doctor. And I think that's why I love what you recorded for the course, because you're actually saying, no, do go and see your doctor, but this is how you can maybe navigate that to get the outcome that you're looking for. And that's why what you've given for that course is just absolutely invaluable, because if you just think you have PCOS but you maybe don't have that diagnosis, and you're missing out on maybe getting screening or getting extra support for the things that the risk factors that we have increased. So might be you need we've got an increased risk of fatty liver disease, high cholesterol, blood pressure issues, blood sugar issues. There's so much.
Mm-hmm.
So that's why it's really important to get that diagnosis. Don't think, oh, my doctor wasn't there for me, I'm just not going to see them anymore, because for the long term, you need that medical care that the NHS is offering. So if your doctor hasn't given you what you want, what you need, try a different approach, go in there armed with the information and see whether that can help. Or ask to speak to another GP.
Mm-hmm.
Obviously, you know more about the process of that, but don't give up on that, because you will need your GP in the long run. And like you say, it's not that GPs don't want to help, but you really are extremely stretched. You've got limited time and limited resources, and perhaps limited knowledge, because you can't know everything. So I just wanted to get that out of the way first.
Thank you.
But so the way that I help my clients, so first of all, when they come to me, we are looking into full lifestyle. It's not just these are your symptoms, let's work on your symptoms. No, we want to look for the root cause. So what is actually causing those symptoms? So you might come to me with PCOS. 10 people could come to me with PCOS, but they might have completely different root cause of what's actually fueling their PCOS. So first of all, I want to identify what is your PCOS driver. It's not going to be one, it's probably going to be a combination. For some people, for most people, because we know that around 3/4 of people with PCOS actually have insulin resistance. So we know that blood sugar issues are fueling their symptoms. So that will be, let's identify that. For some people, it will be that. But for many people, they'll have inflammation, chronic inflammation. Some people come to me and they actually have come off the pill, and from that they've developed PCOS, and since then they now don't have any periods. But I have one client who came to me, she'd come off the pill, she'd gotten married, she wanted to get pregnant, periods were AWOL. She was diagnosed with PCOS. She came to me. We did a really detailed consultation. So the first consultation is 2 hours because we go into so much. And I literally will talk to them about their medical history, their emotional history, any traumas. We really work through things. Then I write them their detailed plan. Within 3 months of working with me, she was pregnant. And that baby is going to be due in the spring. And, it happens, it can happen. So we really need to identify what's going on with the individual and what is fueling their PCOS or their hormone issues in general. And then we will look at nutrition, lifestyle. So that means their sleep, their stress management, how they're moving their body. And, I send them out a plan and we just implement slowly, and they can always check in with me. But if we just think of kind of like pillars of health, your food, your stress, your sleep, and your movement, it's a great place to start. And then I will recommend targeted supplements as well. But, just I think having somebody to lean on is half the battle. When they come away from that first appointment, having 2 hours to talk about yourself. When do you ever have that?
Yeah.
Having somebody saying, oh, don't worry, this symptom, these cravings, it's not just because you're greedy. This is down to your blood sugar. Having somebody validate what you're feeling. Sometimes, they message me afterwards and just say, I didn't realize I was holding this much baggage, or I didn't realize this behavior was because of my hormone issues. That can be the start of something amazing before they've even got their plan and started implementing the changes. And that's just magical.
Yeah, and that's the thing. Often people don't always appreciate how therapeutic a consultation can be. I recently had a bit of funding from the NHS, believe it or not, where I was able to have 30-minute appointments with diabetic patients, poorly controlled diabetics, and it's only 30 minutes. I would love to have had longer, but just the fact of having that consultation made such a difference that they were able to sit down and to go through some questions that they had, or to sit down and go through their meal plan. The amount of even today, I saw one diabetic patient, and she had really good controlled diabetes when she was first diagnosed, managed with her diet for years. COVID hit and things just fell apart, and now her diabetes is so poorly managed, and she's on 3 different medications, and still her last blood test was through the roof. And I sat down with her. I was like, so what's happened? What changed? Why can't you implement those things anymore? And then just like, so what are you having for? And I was like, and she goes, I don't eat that bad. You know what? I have too many chips. That's what she's saying. I have too many chips and I really like jacket potatoes. I was like, okay, no, let's just stop. And let's write down a full day of what you eat. When you start eating, when you finish eating everything that you have. And she was like, yeah, so I have like a cup of tea and maybe a couple of biscuits before I go to work. And then I'll have, when I get to work, I have a couple of slices of toast, then maybe a couple of bags of crisp. And then she was going through, and I was like, okay, so how do you feel about your diet now? She goes, actually, I didn't really realize I was having biscuits for breakfast. And, sometimes we don't give ourselves the opportunity to sit down and really evaluate things. And it's amazing what you're doing. 3 months and pregnant, like those kind of results are incredible. And although you're there, you're giving the information, you're helping them along, everything that you give them to your clients has to be implemented by them.
Exactly.
And so empowering as well to do that and know that, yes, it was because Lauren helped me, but also it's because I did something and I implemented something. And what that must do for your like self-belief, self-efficacy, self-esteem, to actually see results from things that you've done, not because that you were given a pill to take or you were given this, but because something that you did. And that's why it's just so important. That's incredible.
No, it is, and I'm so chuffed for her because she was so stressed out about it, and she really didn't I think she was just lost. And she didn't, well, she wasn't speaking to any friends or family about it. I think she was quite embarrassed, which was really made me sad. And
Mm-hmm.
I actually recommended to her that she start therapy as well. And I said to her, I think you have some things you need to talk about and get off of your chest. And
Mm-hmm.
she really, really took ownership. And it was hard for her to do that. It was hard for her to reach out to a therapist as well. But I think what I love about what I do and how I've created this approach is that I feel that the best way we can help people is to empower them
Mm-hmm.
and tell them and show them why they should be doing something. Because I think when you know why, it makes you want to do it. When you
Yeah.
truly understand the impact that you can have for your own health, you're
Mm-hmm.
going to want to do it. And like you say, when they see those results, how amazing do they feel about themselves?
Mm-hmm.
And yeah, it's just incredible. And I know how they feel because I was there and I still
Yeah.
am there. I still have to be very conscious and mindful about the fact that my body will always be a PCOS body, and I will always need
Mm-hmm.
to fit my diet and lifestyle around that.
Yeah. And that's the thing, like, that's what's so incredible about the difference of having a practitioner that has a lived experience of something that you're going through or something similar that you're going through.
Mm,
Um, so I've been a doctor now for eight over 8 to 9 years. And in that time, when I first qualified, I was 23. I wasn't quite married yet, but I
mhm,
was I was 23. I had no children, and at the time, I think I was a good doctor for the level that I was at. But
mm,
since getting married, since having children, and having my own health issues, I also went through burnout 2 years ago. And my own
mm,
mental health issues and depression, anxiety, everything like that. Today, the doctor that I am right now, although I would have loved to have not burnt out,
of
I'm so
course.
much better at
Mm,
treating my patients today than I would ever have been if I didn't go through anything.
yes.
Just like seeing
Yeah.
children, seeing a pregnant woman, just because I've been pregnant before,
Mm,
just being able to like serve a mother because she's burnt out, and I can just see it in it. Like when
yeah.
she walks in the room, I'm like, I know what's happening here, the
Yeah.
difference of that, having that lived experience. And what you're saying, what you do for your patients as well, because you've gone through it, this whole thing of self-belief and self-efficacy, it can come in, you can build it up. It's like a muscle that you can build. And
Mm,
yes, it's from doing things and achieving things yourself, but also seeing somebody that's gone on that journey as well.
yeah.
So the amazing empowerment you're giving to your patients, that I have PCOS, I'm of a healthy weight, and I'm a mom.
Mm.
That's, yeah,
I
amazing.
hope so.
How was your pregnancy, by the way? How did you, because you have that belief in your mind that I can't have children. What was it like
Mm.
finding out that you were pregnant and going through the pregnancy? How did you
Oh,
find that journey?
do you know, it was bittersweet because,
Mm-hmm.
of course, when I found out, I was elated. I
Mm-hmm.
could not believe it. But within probably an hour of finding out that I was pregnant, I was just crippled with fear
Yeah.
because I just thought, well, if my body has never even been able to actually have periods, has not even been able to have a regular cycle, then how on earth is it going to maintain this pregnancy? I
Mm-hmm.
didn't have any trust in my body. I didn't feel like I could rely on my body because it always let me down.
Mm-hmm.
And I had to really try to work through that. I was just so terrified. I kept going to the toilet to check that I was bleeding. I'd be waking up multiple times in the night just to go and check that I hadn't started bleeding. And it was really difficult. When
Mm-hmm.
I actually talking about it now, when I think back, it was really tough.
Mm-hmm.
But as time went on, I guess I just had to trust. I had to trust.
Mm-hmm.
I had to believe, and I really had to just um, I took the ball by the horns in many ways, and I did what I knew I could to support my progesterone levels. Of course, being me, and I am a bit of a control freak, I was testing my own progesterone levels
Oh, wow.
privately and checking. I was checking my levels, and I was
Mm-hmm.
doing all of that because I knew that that's not something that would be offered on the NHS.
Yeah.
But sometimes you know too much when you're in the medical field, or you're
Oh,
looking into
yeah.
those sorts of things. But that to me, that helps me because I felt like I
Mm-hmm.
was doing something and I needed to feel like I had some sort of control over it because I felt so out of control.
Yeah.
But as time went on, I really started believing, well, this is happening. And,
Mm-hmm.
you know, and then I got excited. I really got excited. But initially it was tough. I was managing to balance my blood sugar levels pretty well. Then towards the end of the pregnancy, because I did pass my gestational diabetes test, that was all fine. And then at the end of the pregnancy, I did start. I had some of my urine tests came back just a little abnormal. And I didn't ever end up being diagnosed with GD, but I think part of that is because I know how to manage my blood sugars.
Yeah.
I think actually I maybe did have it, because since then my HbA1c it's really shot up. So now I'm at a point where I'm really having to be quite serious about my blood sugar levels. And it's not uncommon, as you know, for people to have gestational diabetes in pregnancy and then after that have blood sugar issues. And I think that might be what's happened here. And I was already sensitive, and now I think, when I last was tested, but this is another thing, my result came back, I think it was like 1 point under pre-diabetic range. And instead of the doctor saying to me, you're 1 point under, we should probably manage this, it was just watch it, like watch your levels because they're creeping up. But it's like, that's 1 point. So if I was 1 point more, what would your approach be? It's like, it's all very like, has to be to the letter, doesn't it? And it's all, you have to follow things like you're kind of in your boxes. So that's a bit frustrating, but luckily I'm able to manage this myself, and that's what I'm doing. But yeah, the pregnancy was fine. She was they said she was a big baby. I had a home birth, which the doctors, it was really amazing. The doctors were heavily dissuading me from doing it because they had said, there's signs of her being big. We're a bit worried about it. But I was like, I'm not going to be induced. She'll come when she's ready. If my body can grow the baby, my body can birth the baby. And I did, and I was fine, not a single tear.
Yeah, amazing. Awesome. And that's it. I'm not surprised at all by what you've described about finding out you're pregnant and then that sense of fear coming over you. I'm not at all surprised. Because that's the ingrained belief, isn't it? What we talked about before, that your body can't do this. And just you sharing that, I think it's going to help a lot of people to realize that sometimes we have these thoughts. You're not by yourself, feeling sad or fearful during what should be this most amazing, joyous time. And I think a lot of the time we're told that we should feel like this, we should feel like that, or this is how this should be experienced. But a lot of the time we've got life that's happened beforehand. And so the fact that you went through this thing of being told from the age of, I can't remember, 14, 15, 14, being told that you weren't going to be able to have children, you're going to have a lot of difficulty, and the journey that you went through to be able to do that naturally, even you achieved it, you've done it, you've got a beautiful, healthy little girl, but that's still there. It's still part of our brain. It's still part of our makeup. And even I know, and it's funny, the things you sometimes feel a bit, I don't know if the word is insane, but you feel like you're going a bit mad, like how you can feel when you're pregnant. And what you're saying about checking your progesterone levels, my best friend, she's a registrar in obstetrics and gynecology, if I can get the words out. And every now and again she just scan herself, she'll be just do a quick scan. You can't
why not though? Because it's just, you can. So I had so many early scans. We kept going, paying to get them done. I mean, I'm so glad that that's quite accessible. It's quite affordable, really. Because I just didn't trust. At that point, you can't feel anything. I just kept thinking, I'm going to go to that 12-week scan, and she's not going to be alive. And I just so, oh God, it's just a minefield. And sometimes I thought, you know what, this is ridiculous. But I thought, well, what do I leave myself to suffer? Or do I just go and get that reassurance? And I'm lucky. I know not everybody can access the extra scans, but I did everything that I could do to get myself through that. And I'm so glad that I did. I had to.
That's the thing, scanxiety, that it's that's what I like to call it. It's just so real, especially, if you're someone that has gone through recurrent miscarriages, or you're someone that's struggled to get pregnant, or like me, I had scanxiety. I've not had any trouble fertility issues, but because of how much I'd seen, you talk about this knowing too much. I had seen the complications from birth, pregnancy, I've just seen so much. And because of that, I remember having to retrain my brain in terms of what I thought about birth, retraining my brain that you know what, you don't have to be in a hospital. Retraining my
Mm,
brain that, you know, just about so many
yeah,
things. It was just so difficult. And it was so difficult to
I bet.
hear some advice given by some doctors and then making my own decisions, because everything had been so medicalized for me. I didn't see normal birth.
Mm,
So when you're a doctor and you're training, when you're a doctor, you don't see normal births really, unless you're
mm,
like really going into obs and gynae. Even if you're not, even if you do, often they only call the doctor when there's an issue. When I worked in pediatrics, I only got called to birth if there was a issue with the baby or they were worried
mm,
there was going to be an issue. I only got called to, like, from when I was working at obstetrics and gynecology, I only got called if there was an issue. I only saw in clinic, I only saw high risk women.
mm, mm.
That's the only thing that I saw. And so when it came to
Wow.
me, a low risk women, I was like, you know, you can't just do it. Like, you need to have
Mm,
everyone there. You need to have all the doctors. You need to have like
yes.
all the intervention. There isn't a way of doing it because I didn't see it.
Mm, wow.
But it's just about retraining your mind, isn't it? Um,
Absolutely. It's
but
incredible.
isn't it? It's just
Yeah,
how your brain works, the
I
information you take
know.
in. That's why you got to be
Wow.
compassionate with yourself. But there was something
So
really
true.
interesting that you just said about, and I
Mm,
know you just said it in passing about the scans that you were having, that you were able to afford to have those scans.
mm,
I think a lot of the time we think, oh, you know what, I don't have the means, or I don't have the luxury or the privilege to be able to pay for my healthcare. I don't have the
mm,
means to be able to go and get a PCOS practitioner or a health therapist, I mean, a nutritional therapist. I don't have the
mm.
money to do that. So what can I do? Like, you know, you're just kind of there. But I think part of taking health into your own hands is challenging that. I know there's a lot of people, and I know that there's a big social economic disparity here in
Yeah,
England, all over the world. And I know there's lots of people who are living below like the poverty line and
yeah.
on really low incomes, but there are also a lot of people who are not prioritizing their health as something that their finances should go towards. I think it's part of being in, you know, having the NHS and just not
Yeah.
believing that you should have to spend anything on your health, but being able to, you know, spend money on lovely things like travel, or being able to
Mm.
spend money on your house, or being able to spend money on all sorts of things. But really, if your health isn't there, what's going
Oh,
on? It's a bit of a
you have
challenge to people.
no, definitely. I mean, if without your
Mm-hmm.
health, you have absolutely nothing. But I
Mm-hmm.
feel like for so many people, it's really far down the priority list.
Mm-hmm.
But people don't blink, don't bat an eyelid about going out for dinner and spending a couple hundred quid.
Mm-hmm.
But that couple hundred quid, my course, the reason I wrote the course was because I do understand that not everybody can afford to see me one to one.
Mm-hmm.
But I feel very strongly that there's women should have access to the information that I provide.
Mm-hmm.
So I thought by doing the course, I can make that accessible. I've priced it at a price point that I think is fair to the value of the course, but also
Mm-hmm.
is accessible to people. So I've priced it, it's under £300, but
Mm-hmm.
it literally covers everything. I mean, you've had a look
Yeah,
at it.
yeah. It's jam
So
packed, guys.
it's jam packed full of everything. But still, I have people coming to me saying, oh, it's just not something that I can afford. I understand that we're in a
Mm-hmm.
crisis right now. Cost of living is insane. But would you go and spend a couple hundred quid buying some bits from the shops, buying
Mm-hmm.
clothes that you're probably not going to wear, or you don't bother taking back and you could have got that money back, or
Mm-hmm.
spending it on a dinner out? It's how you prioritize, and it's the value that you place on your health.
Mm-hmm.
I've I have people sometimes in my DMs asking me for help, and I can't do that. I can't give people help in the DMs.
No.
I'm not legally, I can't do it, but also without knowing your history,
Mm-hmm.
I really can't give you any reliable advice. And people seem to get upset and they say, oh, I can't afford it. And I'm like, but can you afford it?
Yeah.
And
My
I
question
try, I
is, can
do.
you afford not to have it? That's the more of the
Yes.
question. Can you afford not to?
Yes. Can you afford not
Mm-hmm.
to? And I have people say, I'm desperate to have a baby. And I'm like, okay, but when I was desperate to have a baby, I did everything,
Yeah.
everything I could. Wasn't just things I had to pay for. It was all of, there's so much stuff that we can
Mm-hmm.
do for our health that is free. But I just find that people are reluctant to take that responsibility for themselves. I was actually
Mm-hmm.
talking to another doctor about this recently, and she was saying that there is this, like you say, this reliance on the NHS. Why should I do it myself?
Mm-hmm.
But one, the NHS is, I don't think the NHS is always going to be there. And
Mm-hmm.
it's struggling, it's on its absolute knees.
Absolutely.
And secondly, we can see, like you say, was it 30% of health issues are 10.
10%.
Oh
Just
my
10%
God.
really is helped by traditional medicine.
Right. So
10%.
we know this. So what the other 90% is down to us. How can we rely
Mm-hmm.
on 10% chance of, or 10% of it? We just can't. And so I'm getting a bit riled up because I feel really strongly about this. And it,
Yeah.
it really frustrates me that it's, we have so much power over our
Mm-hmm.
lives and over our health, mental and physical health. But sometimes people don't want to do the most simple of things. And
Mm-hmm.
it's really frustrating.
Yeah, definitely. And that's the thing, like, there are, I had a patient, and honestly, every podcast, people can get bored of me telling you about I had a patient, but I see
I love
so
it.
many people from so many different walks of life. And I have, I'm not gonna say a patient, I have many examples of this.
Mm,
Of right now in the NHS, in where the city that I work in, getting therapy is difficult.
yeah,
You often have a very long wait, and then when you get through to therapy, it's usually a very specific type. It's cognitive behavioral therapy,
yeah.
which is great, but doesn't work for everybody. And
Mm,
often it's 6 sessions that you get given. Sometimes it's just over the telephone, and then that's it. But in that time, so people are having depression, anxiety, and actually antidepressants are really supposed to be safe for moderate to severe depression. Mild to
right.
moderate depression should be treated with lifestyle measures and should be treated with talking therapies.
Interesting.
But people are often would rather, I would mention to my patients, okay, this is what the wait list is like, and you're likely only going to get 6 sessions at the end, but you need therapy. Your treatment is what I would recommend is that you need therapy. And
Mm,
there are these different places that you can get therapy. And this is like, the
mm,
ballpark figure. I just can't afford it. And they would rather go into antidepressants, which are proven to only do, if at best, 50%, probably more than like 70% of,
mm,
probably more like 30% of the work to
mm,
actually helping with your depression.
mm,
But they would much rather go on that. And that medication, yes, it's a free prescription for some people, or maybe it's £10 every time you check it
mm.
in. But the impact that can have long term, and
Yeah,
people when they first start antidepressants, and this is not slamming antidepressants, like I said, I prescribe them and there are many
yeah,
people that do need them, but in the first 2 weeks of starting antidepressant, the side effects that you can have as your body gets used to the changes in levels of
yeah,
things like serotonin, the headaches, the sleeplessness, the increased anxiety, people would often rather pay that price than finding therapy where they could find that within 6 months they are actually starting to feel different.
yeah,
And by like the best way to treat depression, anxiety is to exercise, is to eat better, and is to have those social connections, and then to
mm,
go to talking therapy. Those are the best ways. But people
mm.
often, and I see again and again and again, not wanting to prioritize their health and rather waiting the 18 months or the 13 months, however it is, to have six
Gosh.
sessions of therapy. And at the end of it, they say it wasn't helpful. And it's
Mm,
like, and I'm
mm,
telling you what can help you. And yes, it involves spending money.
mm.
And like I said, I know not everyone can do it, but there are many people that can
Yeah,
if they
there
were
are.
just to change certain things.
Yeah, I know, I know. It must be very frustrating for you seeing that kind of day in, day out.
Yeah, there are some amazing patients too. There's lots of amazing
Of
people, and you understand
course,
that
of
it's all like
course.
it's all complicated. But yeah, it is quite
Yeah.
frustrating.
Mm,
But more and more, I'm having to recommend to patients to go privately to seek these things out. And so,
mm.
as we start to wrap up the episode, because I know I don't want to take up too much of your time,
It's
and you've got an
okay.
amazing singing gig later on today. I wanted to know, as somebody that not only helps people take control of their health and get on top of, in particular, the PCOS, and but
Mm,
also as someone that has done it themselves, where would you say to start? If someone that is
gosh.
struggling, not
Mm,
like someone right now who doesn't feel like their health is optimized, they don't feel like they're getting the answers, they don't really know how to do something about it. What would you say to do in terms of just starting, not all the steps that it takes, just
mm.
starting?
I would say just start with the basics. Just really look at, like I said, the pillars of health. Look at your nutrition. Sometimes it's really simple things. Like you say, that lady didn't know that she was starting her day with biscuits. How are you starting your day? Are you skipping breakfast? Are you hungry and you're pushing yourself to just not eat it because you think, maybe you'll lose weight that way, or you're not,
Mm-hmm.
you're just not hungry? Can you just look at those simple things? Or are you too sedentary? Could you just walk? Could you walk instead of driving for your short trips?
Mm-hmm.
Are you sleeping enough? Are you staying up watching Netflix when actually you could try and make sure you get an extra hour or so? It
Mm-hmm.
really is the simplest of things sometimes, and they have such a huge impact. I think when we often when we think about getting started with a health kick or, trying to change something, we do everything at once and we end up we do too much and we can't maintain it because it's just
Yeah.
not sustainable because we're just overdoing it. I think just break it down into small things. I'm going to move a bit more. I'm going to make sure, with PCOS, I always say, start with your breakfast. Make sure that you're eating a protein-rich breakfast. Don't skip it. Move more and try and get more sleep. That can be enough to make a difference to symptoms. It's not going to do everything, but that can be a great place to start. And obviously, if you've got PCOS, I would say go and buy the complete PCOS plan because it is invaluable. When I talk about my journey, everything that I've learned and implemented myself, I tried and tested everything. And then I've worked with my clients in clinic for the past 3 years. Everything is tried and tested, and I've put the best of the best into that course so that you don't have to just try and just do everything. It's all there, and it truly is invaluable. And I can say it is because I've lived it. And if you're somebody who wants to get pregnant or is really suffering with symptoms of PCOS, it's a no-brainer because you know that by following those steps, you can really change your life.
Yeah, absolutely. Thank you. And yes,
Thank
guys,
you.
please go ahead. If you not even if you just have PCOS, if you think you may have PCOS, you don't know like where you're starting with it, you've got some of the symptoms, you're not sure, the course is a great place. And so Lauren, please share everyone. I'll put all the links in the description notes so that everyone can go and find it. But where else can we find you as well? Where can people follow along with your journey or get in touch with you if they want to use you as their therapist as well?
Yeah, absolutely. So London Wellness Coach is my Instagram, and that's where people tend to find me. And you can always DM me. I love it when people DM me because I set that up to be a community, and I love that it's becoming something, like that.
Yeah.
And then the plan is at thecompletepcosplan.com. But yeah, come and find me. I've just finally set up my TikTok, and I'm not great at it, but
don't get me started on TikTok.
I'm like, I don't understand. I don't know what's going on here, but I'm trying. But come to my Insta. I probably aged myself a lot right now. Come to my Insta and come and find me there.
Yeah, brilliant. Thank you, Lauren. Have an amazing day.
You.
See you. Bye.
Thanks. Bye.
And that was my conversation with Lauren. I really hope you enjoyed it. I found it so interesting and fascinating to understand, how we can work with how doctors, often when we think about health, we think about, working with doctors or nurses or those traditional ones, but actually meeting people can help you along the journey. Like wellness coaches, health coaches are invaluable. And so I really hope you enjoyed. Don't forget to go and follow Lauren on all her different platforms. And if you are somebody with polycystic ovarian syndrome, have a check out of her course, the complete PCOS guide. I think that's what it's called. Anyway, I said it in the episode. But yeah, go ahead and purchase it if it's something that can help you. And don't forget to leave in the comments, send me a DM on Instagram and tell me what conversations you want to have next. And if you'd like to be a guest, hit me up. But yes, until next time, thank you so much for watching. And don't forget to subscribe, like, share, comment, and rate and review this podcast. Thank you.